Well, good evening and welcome. We're so glad to have you here with us this evening, and also welcome our service streaming viewers. Thank you, Scott. Get me in the right direction over here. All right. So my name is Linda Barrow, and I am with Elder House PACE. But I'm also to have the pleasure of working with this fabulous team that we have that also represent other healthcare professionals. And to bring the ACAP Cape Fear to our area, and it put all this together for the monthly programs that we have. So ACAP stands for Adult Children of Aging Parents, and it was started over 10 years ago by Francis Hall. And ACAP's mission is to provide information and resources, support, and community. So tonight you expect a presentation by our presenter here, and at time there will be some time at the end for questions or answers. And things kind of wrap up around here about 7:30. All right. I have my cheat sheet that I've been provided. All right. So if you have not been added to our email list, please, there's a little form on the table. Please fill that out and just leave it on the table. We'll pick that up. And also there's a feedback form on the table. So if, we'd like to hear what you think about the evening and if you actually received any informative information. So the restrooms, if it's the first time you've been here, if you go down to the reception desk down here, you make a left and they'll be all the way down there on to the right. And anyone that has our shirts on, except for Scott over there, I'm calling him out now. Any of the team can here to help you answer any questions, definitely about any other service that we have here. So ACAP programs are free to the public, thanks to the generous support of our sponsors, all of whom have provided resources that help support seniors and their adult children. And there's information on the back table. Please take it when you leave. And tonight, we're very fortunate to have with us Brodie Turner, and he's going to be presenting Long-Term Care, Understanding the Options. He is a financial service professional with Bankers Life. In that role, he helps retirees plan for their retirement and navigate their needs of Medicare, long-term care, final expenses, and overall retirement planning. So all to you, Brodie. Nice to have you with us.
Thank you. I'm really excited to be here. I feel like this has been a long time coming. I've been coming to ACAP for quite some time now, and I'm really excited to actually be speaking at one of these events, especially on a topic that I have grown to be very passionate about. I've been in this industry for about 2 years now, and long-term care has become something that I've grown very passionate about within that time frame, especially just because I have come to see the amount of people that need it, and especially the amount of people who have begun unprepared for it. This is unfortunately one of the biggest issues that the U.S. is dealing with right now. It's the number one reason for bankruptcy in the United States. And I think it's one of those things where either we know someone directly or we know somebody that knows somebody who has needed this kind of care. And I think the importance of it is only growing more. So my role here tonight is really to just give you guys a little bit of an education on what long-term care is, the actual risks that go along with it, and a couple of the ways that we can actually go about planning for this kind of situations if it should ever happen to occur. So the first thing that we'd be more than less talking about is what is long-term care as a whole. So long-term care is really the support services provided to those who are typically in retirement or unable to perform their acts of daily living. This care is really designed so that people that need the care can remain living as long and as independently as possible. I think maintaining independence as people are aging is something that's very important to a lot of folks. I speak to folks on a daily basis and I'll ask them what their biggest concern is if they do end up needing this kind of long-term care. And a lot of times they'll tell me that they want to be able to be on their own as long as they can, or they don't ever want to end up in some kind of facility where they don't have the care that they deserve or that is that they require. And I think anytime long-term care really is needed, we want to make sure that we're giving that care in a very high quality way to the folks that actually end up needing it. So people that need long-term care, like I said, are those who are unable to perform their acts of daily living. And the acts of daily living are toileting, bathing, eating, dressing, transferring, grooming, and of course, anything that's cognitive. Those are things that we just kind of, we all do those on a day-to-day basis without even thinking about it. You know, it's something that we just go about throughout our day, and it's very simple to us. But when you're unable to do one of those things on your own, and you actually have to have assistance in doing so, that's typically when some kind of long-term care is needed. Now, that long-term care can be provided by any kind of family member, a caregiver. I'm sure that we have probably a couple of caregivers in this room. Is anybody actively a caregiver for a family member or anyone that they know that needs long-term care? Okay, so yeah, definitely a couple. I know that can get extremely difficult at times. It's something that I have firsthand seen. I know my great aunt, who have just recently passed away, was in the exact same position where she needed somebody to watch her very consistently because she was unable to do the simple things that we find so easy to do on a day-to-day basis. It was extremely difficult on some of our family members who were being the active caregivers. And most of the time that those that are unable to perform their acts of daily living will typically be seniors and those that are in retirement. But of course, the need for this can really be pretty sudden at times of, you know, anyone that's undergone and had a stroke or a heart attack, a car accident, or anything of that nature. They would need this kind of care a lot sooner. I've known people that have been in my industry, in my office, a little bit longer than I have, who all have some kind of different story about a client that they knew that wasn't really interested in long-term care at the time because they were very young and it was a problem that was going to happen later down the road. And unfortunately, something would happen to their health very quickly after that made them ineligible to receive the care or receive any kind of insurance plan for the care. And I think that can end up being a very big issue. And this is why I really like to be someone that can help kind of raise a lot of awareness around this topic. So something that's really not spoken about as much as actually just needing the care is really the risks that go along with it. You know, how real this actually is and how likely it is that you'd end up needing it. It's kind of a somber thing to think about, but the likelihood that anybody will need long-term care over the age of 65 in their lifetime is about 70%. You know, those are some pretty big odds. So to kind of put that a little bit more into perspective, there's risks that we face every day that we have already protected and planned for. The odds of having a serious house fire are about 1 in 1,200. But that's something that we all protect against. Everybody has homeowners insurance. It's a no-brainer. We think automatically, I cannot take the burden of having to repay to have my entire house built back up if it were to be knocked down. So we have to have homeowners insurance. It's a very smart decision that most of us have. Along with the odds of our car being totaled are about 5 in 1,200. And again, everybody has that car insurance, the auto insurance, to make sure that we're protected there because it's a business decision. And we have to make sure that if that were to happen and our car was totaled, we could not incur the weight of that kind of payment. Odds of being hospitalized are about 105 in 1,200. Those odds definitely go up a little bit, but everybody has some kind of hospital insurance. Most of us do have some kind of hospital or health insurance. Those of us that are on Medicare are going to be covered through that for their hospitalization. But the odds of needing long-term care are 720 out of 1,200. And the people that have prepared for this are only about 10% of the population. So 70% of people need long-term care or will need long-term care at one point in their life. but only 10% of people have prepared for it. And the reasons that this typically are is because it's just not something that people want to think about. It's obviously never a fun idea to think about you needing that care sometime at one point later down the road in life. But with the over 70% chance of this happening, it's something very important that you need to make sure is covered in some form or fashion. As far as the cost of long-term care typically goes here, and these are just the numbers for North Carolina, here's the average costs of where these care facilities are provided. So home health care can typically be around $63,000 a year. Sometimes that's just an average cost. It can go down depending on how often the care is needed. I know what's really phenomenal about home health care is that the hours are typically very flexible. And if somebody doesn't need 24/7 round-the-clock care, it's going to be a whole lot less expensive than putting somebody into a nursing home, and they wouldn't need all of that time, especially when, if they only need the care 2 or 3 times a week and they just have one person coming in, helping out, walking the dog, doing a little bit of the grocery shopping here and there. The home health care is a very big benefit. Going up to the assisted living, the numbers jump up quite a bit. It's going to be about $68,000 a year. I always want to say 100 because 68,000 just seems like an absurd number, but it is true. This is the average cost of the assisted living here in North Carolina. Then, of course, the semi-private nursing homes is going to be $89,000 a year on average. And I'm sure we all are aware of the care that's provided in those facilities are typically not of the utmost quality that we feel that our loved ones truly deserve. I know we've all heard horror stories of the different kinds of long-term care facilities that they've known, that they've been in. It can typically be kind of a nightmare. The people can sometimes be there only to receive a paycheck, and that's why I honestly always go back to the home health, because I know the people that are typically in the home health care are going to be a lot more willing and apt to provide the care that's actually deserved, as well as the care is just a lot more flexible. And in a semi-private nursing home, typically the room that you're going to have would be shared. That's what semi-private is. And we wouldn't ever want that. We want anyone that is needing this to receive their care in home, in the comfort of their own home, where they're used to and where their symptoms can be much better managed. And of course, the most expensive being the private nursing home, having your own room and 24/7 round-the-clock care, just on average is $96,000 a year. And again, the crazy thing is that only 10% of people have prepared for the cost that this could end up incurring. With a 70% likelihood that it'll end up happening, it is the single most likely thing to happen in retirement that could deplete all of your assets. We work our whole lives to be able to build up and have some kind of comfortable retirement. And of course, we all have always prepared for the life insurance, the final expenses, the medical insurance. But on average, when you're talking about life insurance, the average funeral is only going to be about maybe $10,000 to $15,000 if you do have a very nice funeral and a burial and things of that nature. Of course, it's always nice to leave a little bit of a legacy behind to your kids as well, if that's something that you would be deciding to do. But the thing that's going to hurt the most in some kind of situation like this isn't the $10,000 or $15,000 that it's going to cost to have the burial or the cremation. It's going to be the 2 years before that, where you're having to pay $96,000 a year to have this kind of care. And there's only a couple ways that you can go about preparing for it. So the only ways that you can really cover long-term care is either paying it for yourself out of pocket, which obviously is probably not the most desirable scenario. The second option would be going on to Medicaid and having all of your assets spent down, which means giving up the IRAs that you've made, your house, the cars, and those things, and they will typically then send you into a facility not of your choosing. They get to decide where you want to go. And the third option there would be finding some kind of individual insurance policy to help cover these costs. Now, a lot of times there's a couple misconceptions when covering long-term care goes. Medicare, unfortunately, no longer covers any long-term care needs. They will do some as a skilled nursing facility would go. And the way that that works is you would actually have to be 3 days inpatient to the hospital, and you would have to go to the skilled nursing facility that is directly attached to the hospital itself. And what those nurses will help you out with in that time frame is some, occupational speech therapy, physical therapy to get you back up on your feet. And it will only cover up to 100 days in that facility. After that, Medicare will kick you out, and you will no longer be able or eligible to receive any kind of long-term care, especially any kind of custodial benefits. So custodial care benefit, acts of daily living, is something that Medicare will not touch at all. It's something that they used to get into a little bit, but unfortunately, because it became such a big problem, because it was costing so much, it no longer is part of Medicare's book. As a matter of fact, on page 56 of the 2024 Medicare and U book, it will make the statement. Along with TRICARE for Life is another misconception that a lot of our veterans will be receiving. They like to think that when they went and served, that they will continue to get some long-term care coverage when it's needed. But unfortunately, TRICARE for Life on page 18 states that they no longer cover any needs for long-term care either. Along with, of course, the VA benefits is something else that's not covered under long-term care. There are a couple of benefits that they'll provide along with the skilled nursing facility, but it's not something that any kind of long-term or custodial care will be provided. These are the couple of pages that I was stating about previously. Medicare and U, page 56. It'll say up at the top in big black bold letters, Medicare and most health insurance, including Medicare supplement insurance, do not pay for long-term care. So just to let you guys know, that is the only statement in the Medicare and U book that is highlighted in big black bold letters. So if there's something in Medicare that the government is highlighting in big black bold letters for you to look at, I think it's very important. That is something to pay attention to. Along with the TRICARE for Life handbook, page 18, does TRICARE for Life cover long-term care? No. Long-term care or custodial care is not a covered benefit. However, you can qualify to purchase long-term care insurance through commercial insurance programs or through the federal long-term care insurance program. So what are the options? I talk a lot about long-term care insurance as a whole, but what does that really look like? There's really two main options that can be provided as far as long-term care goes. And what those are is traditional long-term care insurance, which is a reimbursement for policyholders that are unable to perform 2 or more of the acts of daily living. And that reimbursement works up to an amount that is a pre-specified limit for what you purchase the policy for. And those services will assist folks with the acts of daily living. There's a lot of traditional long-term care insurance policies out there that will help cover needs not only for nursing homes and assisted living facilities, but also so that people can receive their care in home. So I think that's the most important part of all of this. A lot of times when I am speaking to people on this initially, I will talk to them and I'll say, have you made any plans for long-term care? And immediately their first thought is, oh, no, I don't want to go into a nursing home. And that's exactly why I think these policies are so important. Because if you decide to push it off down the road, or you don't make any kind of plan for it, and your only option for when long-term care arises is Medicaid, then you will have to go into a nursing home. You will have to go into the facility that the government chooses. And you'll have to spend down all of the assets that go with it that you worked so hard for your entire life. But in making the choice to look at some kind of individual insurance policy to help cover it, you can receive the care wherever you want. You can receive the care in home, an assisted living facility, at a nursing home, all of your choosing. insurance companies do not have regulations on which individual facilities you have to receive this care from. Now, outside of that, there's also life insurance, believe it or not, is a way that you can pay for long-term care. Of course, the policies are typically going to be a little bit larger if you want to have to use life insurance to pay for your long-term care, but it is an option. And the way that it works is that some life insurance policies will have the option to access up to right around 75% of your death benefit early in case any needs for long-term care do arise. And that works in the exact same fashion as the traditional long-term care, in the sense that you can use it for anywhere you want. However, it doesn't act as a reimbursement. It is a set amount that you have at the beginning. Like if, say, you had a $100,000 life insurance policy, you could use $75,000 of that early to pay for long-term care if the situation arises. This isn't the case on all life insurance policies. It is what's known as a rider that is attached to some life insurance policies. And sometimes that is a route that people do like to explore whenever they're looking into some kind of long-term care insurance. Of course, a lot of us will be fortunate enough to have family members that are in town and can help provide some of the long-term care. And I'm always very happy to hear that the children have stated that they're going to be able to help mom out a little bit whenever she is, in the situation. Of course, sometimes this can be very difficult on those individual caregivers, as well as sometimes they won't be fully licensed to do all the things that they need to be doing. One of the benefits to getting some kind of additional long-term care insurance, whether through traditional or a life insurance policy that can help cover the long-term care, is that you actually wouldn't have to get a policy that's quite as large. If your children are going to be the care supervisors and do a little bit of help here and there around the house and maybe, take care of you 2 to 3 days a week, then you only have to have a little bit of a smaller amount to help cover the remaining days, or to help cover the nurse that needs to come in and do a couple more things that people aren't licensed to do. Either way, I think it's definitely a good benefit to have, especially if you do have children that are going to be providing this kind of care. Now, outside of that, in 2024, there's only 8 companies that still offer any coverage for long-term care. I went ahead and listed them. This is from the North Carolina Department of Insurance website. As you can see, Bankers Life is one of them, which is the company that I represent. It's the one that I work with. But also Genworth, Northwestern, Mutual of Omaha, State Farm, Thrivent Financial, Transamerica, and United of Omaha Life Insurance do have long-term care insurance policies about them. So if this is something that you have ever looked into before, or at least if it kind of piqued your interest, I think those are definitely the companies that you would want to look into, because that's kind of all that's available. There used to be over 100 companies that offered any need for, or that offered this kind of coverage for long-term care. But unfortunately, there's only 8 left, just because it came so much of a problem. People were not understanding, or the companies hadn't priced their policies out correctly to know that they were going to have to be paying out this many claims. And a lot of the companies ended up having to cut off their supply of long-term care as a whole, or else they were going to risk going bankrupt. I know John Hancock was one of those companies that used to offer long-term care, but had to get out of it because they were not able to cover the amount of claims that they had to pay out. And I know there's not a single one of us in this room that has more money than John Hancock Life Insurance Company. So it's just a very important thing to be looking into, and give a good consideration as to weighing out your options in looking into any kind of long-term care insurance. All I have to say is that I'm typically a little bit of a fast presenter, and that is all that I have for you guys. But I will open up to a couple of questions just to, for any of you guys, if you have any questions for me on any of these topics.
So the life insurance, the rider that you talk about, is that usually on whole life or term policies when you buy them?
It is
whole life, wouldn't
It is usually on a whole life or universal life policies.
Okay.
Mhm. Again, that's not going to be for all companies. Some might have an ability to access it on term policies. It'll vary from company to company, but most of the time it is whole life or universal life.
And when you take out long-term care insurance, is the older you are when you're taking out the policy, the more expensive it is?
Absolutely.
Okay.
Absolutely. The recommended age when looking into any kind of long-term care insurance is anywhere between 40 to 50. After that, it definitely gets a little bit more expensive. Of course, the people that I sit down with on an average basis are going to be anywhere between the ages of about 62 to 68 when they're looking into long-term care. But it's more advised that you look into it early so that your premiums are lower, because it's not one of the insurances that kind of tick up in rates.
Okay.
Most of the time, the rates are going to be locked in from the moment that you purchase the policy.
Did they stop the long-term care for disabled veterans?
For disabled veterans, it's a little bit different. If you are completely and totally 100% disabled, then you're kind of in on a list. And when the situation arises that you would need any kind of long-term care, if you happen to have an opening and your name is on the list, then they'll be able to put you into one of the VA facilities. But VA facilities kind of level of care is a little bit lower quality. However, if you can get your name in on the list, then you do have a chance to be able to receive some kind of benefits. If you're not 100% disabled, it's very difficult to get the kind of. If you're not 100% disabled, it is very difficult to qualify for the VA disability benefits of long-term care.
And then if you have a long-term care policy, I'm sure everyone is different, but what is it required to say, okay, it's time to collect the money?
I'm sorry, could you?
Well, in other words, if you're.
Oh, for yourself to receive the money for the care. So you have to be unable to perform 2 of the acts of daily living. Exactly. So if you only are unable to perform one of them, you wouldn't be eligible for the care. But most of the time, if you are not able to, if you're not able to dress yourself, you're probably not going to be able to get out of a chair. So most of the time they will go hand in hand, but you do have to be able to, unable to do 2 of the acts of daily living.
Is that only in North Carolina?
In North Carolina, that's the requirements.
Is that it? Is that the only trigger? I thought you had to have some evidence of dementia, any cognitive impairment, or it's just that.
Yes, you're absolutely right. If there is, it's either 2 acts of daily living or something cognitive. If anything cognitive has happened, then it will, the policy will start automatically.
So it's either or do you have to have 2 ADL needs, 2 ADLs and cognitive deficits?
Either 2 acts of daily living or one thing cognitive. And now those things do have to be certified by a doctor, of course, in order to be able to file a claim. But yes, it's either 2 acts of daily living or something cognitive, one or the other.
How's the claims paid out towards? How's they determine the reimbursement? Is it based on who you hired, or how do you put in for to be reimbursed to draw that in long-term care policy?
Yeah, so there is a pre-specified amount that is going to pay out per day that you end up needing the policy, that you're going to draw off of it. So whenever you have a doctor certified that you are unable to perform 2 acts of daily living or that something cognitive has happened, then they will pay the money out directly to you, and you can use that money to pay for the long-term care.
What is the average pay per day that you see that's paid out?
There is a very wide range. It could be anywhere from $50 a day to $350 a day.
So it's what you pay for is what you get?
What you pay for is what you get, exactly. Of course, it's going to be a lot more expensive for a policy that pays out more than a policy that doesn't pay. The policy that pays out $350 a day is going to be more expensive than the policy that pays out $50 a day.
And then it maxes out, like that 350 until you reach 300,000 or whatever the level is that you bought. And then once you've reached that, then it's done.
Exactly. It's like a pool of money, and you can pull from the pool as much as you need it until the pool is drained.
And then if you passed away before your pool was drained, is that residual passed on to your heirs, or is it the company absorbs it and it's just like are you paying your premiums and then able to draw it down and then the heirs receive what's left? Or does it, if there was a balance left, does it stay with the company, or is that company?
Most of the time, if there's a balance left, then it will stay with the company.
So that's.
So use it or lose it.
Use it.
Use it or lose it.
Mhm. Now, I will say there's one additional benefit to, I can't speak on every long-term care policy that exists, but I know the ones that I can speak on. Our policies at Bankers Life have recently been given what's called a return of premium rider, where if you pay all of the premiums and then you pass away before ever needing the policy, then the premiums that you paid in are reimbursed to your beneficiaries, just like a life insurance policy. So instead of use it or lose it, it's use it one way or use it another way.
That's really nice.
That is a rider that has to be attached to the policy, but it is a benefit.
The entire amount of premiums?
Depending on age, but yes. In some cases, it can be the full amount. In some cases, it's a little bit lower, but a lot of the premiums can be reimbursed. Have any other questions?
I will share that, I worked with assisted living and long-term care placement. And, it's been many years ago, I was at assisted living. And I will say that majority of, residents that admitted at that time had long-term care insurance. And it was probably been 25 years ago, but Bankers Life and GE is what we had, and what the company is that we didn't accept the long-term care payment. The payment went directly to the family and then they paid us. But I would say that back then you saw a lot more policies than you see now. I think they now are moving money in different areas for long-term, different. Yeah.
I think they expect people to live as long as they are.
Right.
You're 100% right. You're 100% right. And now, especially that medical advancements are becoming better, people are living longer than ever, and people's life expectancy is only going to increase. The need for long-term care is only going to increase as well.
And procedures are more expensive. I mean, the level of technology that's being used in the medical field.
Absolutely. Absolutely.
Interesting. Thank you, Brodie. Any other questions?
Anything else?
Anything else?
Okay.
Okay.
Thank you.
Thank you.
Yeah, of course.
I don't know about you, but whenever I hear long-term, down the road, I want to stay 25 forever, forget them. Somebody take care of me. But we will definitely thank you, Brodie, for sharing that information. And just a little bit at the end here is that if this program will be available on the ACAP website. So if you need to refer back to it or see any other the website on the programs that we have offered, you may be able to go to the www.acapcommunity.org Cape Fear to review those past videos. And thank you for all for joining us. And then, of course, the feedback form there, please fill out and just leave it on the table. There's also next month's flyer to let us know what's happening. And that is going to be on April the 9th at the same time, same place. And it's on facilitating safety and independence as a caregiver. And the presenter is going to be Beth Locke. She is an occupational therapist with Quality Independence Therapy. So please, there's extra sandwiches. Please help yourself. And once again, thank you for coming. But there's other information on the table there. Please take any of the resources if you need them. And if you need any other information, please do not hesitate to call any of the sponsors. All right. Thank you very much.
Thank you.
All right.